The takeaway message of our article is that there is a positive association between methylxanthines, also known as caffeine-derived metabolites, and plasma lipids. This means that greater level of methylxanthines in blood or in urine, indicating a greater consumption of caffeine-derived metabolites, lead to an increase in plasma lipids. Therefore, these findings suggest that an increased consumption of caffeinated beverages lead to dyslipidemia, which is a major risk factor for cardiovascular disorders. My name is Dusan Petrovic, and I am a postdoc working at Unisanté, a general medicine and public health institution located in Lausanne, Switzerland. And the title of my article is Investigating the Relations between Caffeine-Derived Metabolites and Plasma Lipids in two population-based studies. We sought to investigate the relation between methylxanthines, caffeine-derived metabolites, and plasma lipids using a population-based setting. So we use data from two observational population-based studies located in Europe, namely Flamengo from Belgium and Skipog from Switzerland. And then we performed various statistical analyses in order to establish the associations between plasma and urinary methylxanthines, which are independent variables or predictors, and plasma lipids, which are outcome variables. We believe that our study will have an important impact from the public health perspective, as cardiovascular disorders constitute a major cause, if not the main cause of death in Western countries, and dyslipidemia or abnormal plasma lipid levels are the main risk factors. The findings were a bit surprising for us because previous studies have actually showed that the consumption of caffeinated beverages, and in particular coffee, is responsible for a decrease in mortality. And actually what we show here is a detrimental effect on one aspect of general mortality. And this actually shows that an excessive intake of caffeinated beverages mitigates the general positive or beneficial effect of caffeine, because caffeine, for example, was shown to decrease blood pressure on the long term. But here we show another effect, which is detrimental. So there is always a trade-off, you know. And so knowing that an increased consumption of methylxanthine, so an increased consumption of caffeine and caffeinated beverages lead to an increased risk of dyslipidemia, will have an important impact not only in the clinic, but also from the public health perspective. Although this study is based on population-based data, we believe that our findings may have an important impact in clinical practice, as this will encourage general practitioners to provide prevention messages to their patients at the same level as decreasing the smoking or taking care of their weight. New prevention messages related to caffeine consumption could be provided to the patients, but there is also a public health perspective, as further structural measures could be taken for decreasing, for example, the amount of caffeine in sodas or in general foods. And there may also be agentic measures, such as general prevention messages informing the general public, not patients only, about the detrimental health effects of an excessive caffeine consumption. To further confirm these findings, so for example, through an experimental approach where we will be able to clearly demonstrate the causal relationship between the level of methylxanthines and plasma lipids. As I mentioned in the beginning of this interview, we actually performed a cross-sectional study which allowed us to demonstrate an association, but not a clear cause-to-effect relationship. So an RCT would be helpful to further confirm this causal pathway. And starting from this point, we hope that these findings shall provide the implementation of public health measures and preventive measures but also a stronger prevention in the clinic by general practitioners provided to their patients in order to decrease the consumption of caffeinated beverages, which may also have a detrimental impact on cardiovascular health. We would invite health professionals, general practitioners, but also researchers to have a look at our article, as we believe that being able to demonstrate such a relationship in two different and large population-based studies suggests that indeed the consumption of the excessive consumption of caffeinated beverages does have a detrimental effect on cardiovascular health.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.